Colon cancer is the third most common type of cancer among men and the fourth among women, with a mortality rate of approximately 14,000 cases per year, according to data from the National Cancer Institute (INCA). In most cases, there are no symptoms until the disease has spread throughout the body. However, some warning signs may indicate that it's necessary to consult a doctor for further testing. In this video, we'll show you the 10 main early warning signs of colon cancer or bowel cancer, as it's commonly known. Watch until the end, as one of them might surprise you. Shall we begin? Sign 10: anemia. This is a condition characterized by a lack of healthy red blood cells or hemoglobin, the cells responsible for transporting oxygen to the body's tissues. This symptom is common in colon cancer, as intestinal bleeding can occur without any visible signs in the rectum or stool. If you're experiencing fatigue, shortness of breath, or extreme discomfort, this may be due to anemia caused by colon cancer. In this case, it is important to see a doctor for further testing, especially if accompanied by other symptoms on the list. Sign 9: changes in bowel habits. If you're experiencing persistent changes in bowel movements, this could be an early warning sign of colon cancer. Some examples include constipation, diarrhea, changes in bowel movement frequency, incomplete bowel movements, and narrower stools. These abnormal bowel changes can be caused by a variety of factors such as changes in diet, inflammatory foods, and bacterial or viral infections. However, if they last longer than a few days, it is best to consult a doctor to determine the cause. Sign 8: nausea and vomiting. Symptoms of nausea and vomiting are also indicative of colon cancer. Cancer cells can release substances that affect the digestion and absorption of food. Additionally, a tumor in the rectum can obstruct the intestines, leading to a buildup of waste and toxins in the body. This can cause unpleasant symptoms as the body tries to eliminate these substances. If you're experiencing persistent nausea and vomiting along with other signs and symptoms, it's important to consult a doctor to rule out the possibility of colon cancer. Loss of appetite. Cancer cells can release substances that alter the way the body processes food, resulting in a loss of appetite. It is a common symptom in cancer patients, including those with colon cancer. Researchers have found that this symptom is associated with metabolic changes and reduced food intake, and can occur during both the early and late stages of the disease. The sooner the symptom is noticed, the better. Loss of appetite can lead to malnutrition, which can negatively impact overall health. Loss of appetite brings us to sign 6 on our list, which is unexplained weight loss. Unintentional weight loss is a warning sign of various types of cancer, including colon cancer. It can occur due to persistent diarrhea or difficulty in digesting and absorbing nutrients. Moreover, if a colon cancer patient is experiencing loss of appetite, it is also common for them to have unexplained weight loss, as these two symptoms are often interconnected. Sign 5: blood in the stool. This is one of the most common early warning signs of colon cancer. If you notice bright red blood in your stool, it indicates bleeding in the lower intestinal tract or rectum. You may also notice darker stools, which can be a sign of bleeding higher up in the gastrointestinal tract. While blood in the stool can be caused by other conditions, such as hemorrhoids or anal fissures, it's important to see a doctor to rule out serious causes. Sign 4. Diarrhea. Diarrhea is defined as having bowel movements more than 3 times per day and is a common symptom of conditions such as food poisoning or stomach viruses, but it can also be an early sign of colon cancer. While diarrhea isn't an immediate concern, it's important to see a doctor if it lasts more than a few days or is accompanied by other symptoms on this list. Warning sign 3 of colon cancer: pelvic pain. In fact, pelvic pain is not an early warning sign of colon cancer, but pain in the pelvic region can indicate that cancer cells have spread from the intestines to the pelvic area. This is a serious condition that requires immediate medical attention, so it's especially important to be aware of this symptom if you've had bowel problems in the past. Before I tell you the last 2 warning signs of colon cancer, let me remind you that you can leave a like on our video if you're enjoying the content. Your like is very important to us and it costs nothing, so go ahead and leave one. Also, subscribe to our channel so you don't miss all our health tips and enable notifications. Now, let's cover the last 2 signs on our list. Colon cancer warning sign number 2, abdominal pain. This is a common symptom of many conditions, but it can also be an early sign of colon cancer. When cancerous tumors grow in the colon, they can obstruct the intestines and cause a buildup of gas and waste, which can lead to abdominal pain, bloating, cramps, and swelling. In some cases, the pain may be severe enough to warrant a trip to the emergency room. The final warning sign of colon cancer on our list is chronic fatigue. This is a prominent sign of several types of cancer, including colon cancer. In fact, researchers have discovered that fatigue occurs in approximately 80% of colorectal cancer patients, and 30% of patients experience chronic fatigue, especially those undergoing chemotherapy. Furthermore, colon cancer frequently leads to malnutrition and weight loss. Both of these factors can contribute to fatigue. If you are experiencing unusual fatigue, it's crucial to consult with a doctor to help determine the underlying cause. Recognizing the signs and symptoms of colon cancer is vital because early diagnosis can lead to more successful treatment options. To quickly recap, the early warning signs you should be aware of include blood in the stool, changes in bowel habits, anemia, loss of appetite, unexplained weight loss, nausea, vomiting, diarrhea, abdominal pain, chronic fatigue, and pelvic pain. If you experience any of these symptoms, schedule an appointment with your doctor to get checked out. The sooner you identify any changes in your body, the better your chances are for a full recovery. If you'd like to support our channel, please leave a like and share this video with your friends. And be sure to subscribe as well so you don't miss any new videos. Now you should see some other helpful videos appearing on your screen that I'm confident you'll enjoy. Just click on one of them to continue watching more of our content. Remember, we are not medical professionals, and this video is for informational purposes only to help with prevention. Thank you so much for watching all the way to the end. I'll see you in the next video.